Welcome to Season 5 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former health commissioner here in Baltimore, Maryland. Our goal with this podcast is to bring scientific evidence and experience to shed light on critical health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, a special Mother's Day episode of Public Health on Call, in which I get to interview my mom, Dr. Margaret Sharfstein. Let's listen. Hi, Mom. Good to see you. How are you doing today?
I'm doing well, COVID-free.
Good. Well, before we get into this special Mother's Day edition of the Public Health on Call podcast, I thought it would be good for you to introduce yourself to our listeners.
So I'm Josh's mother, and I'm 78 years old. I'm a retired pediatrician, and I have worked mostly in city health departments and at the University of Maryland in College Park as the college health doctor.
So I'd like to start with some questions on COVID. We won't only talk about COVID, but we've been talking about COVID a lot the last couple of years on this podcast. And I wanted to ask you when COVID really became real to you. What was the moment when you realized your life would be transformed?
I think when I saw all the pictures and newscasts about the people, old people in Washington State who were wheeled out of their nursing homes in body bags. And I realized that my age, 76 at the time, was considered old. So up until that time, I never considered myself old. I never thought about my numerical age, but, it was just happy going about my regular life. And then all of the age brackets started to be so important. Over 65, you can't do this. People are getting sick and dying over 65. And so that was a brand new feeling to feel old.
I remember we had a lot of conversations around that time. In some of them, I was not always supportive of what you wanted to do.
That is correct. And we had our nickname for you was Dr. No. Josh, can I get my hair cut? No. Can I go take a walk around the block? No. Can I go to the grocery store? No. So that was very restrictive, but I listened to you and even called you for advice. I think there was this one time we wanted to take a drive in the car. And you said you can't do that because what happens if you get a flat tire and other people have to come and help you change it? That's dangerous. So that was a new life for me.
All right, maybe I was a little overprotective at the beginning. I don't recall telling you that you couldn't take a walk outside, but if I did, that was a little overzealous. But I hope you know it was coming from a good place.
Yes, of course. That's why I listened.
Now, let's just say that in the family, you have a bit of a reputation as a worrier, a world-class worrier. And I wonder, over these 2 difficult years, what were your major worries?
I think at the beginning, the worry was that I was going to get this or Dad was going to get this. And, at the beginning, there weren't enough ventilators even. So that was pretty horrible. Or the thought that you would be very sick and not have anybody close to you able to visit. I think at first it was mainly older people that were thought to be infected. But as the pandemic wore on, it was clear that younger people could be affected and, children. So my children, who were adults, were all really not first line responders, but I had to work in the community and be out and about. The kids, of course, were in school most of the time. And so that was worrisome. And then I thought, am I going to be able to get my medicine? So, I was worried about that. So there were a lot of things to keep me busy worrying. And then, of course, I was worried about the public, the general public, because how could the pandemic be over if all the people who have very poor health care in general couldn't get the equipment, had to be working, couldn't get their medicines, couldn't get to the store. They would get very sick. And that was a terrible worry.
So you worried for yourself, you worried for your family, you worried for the community, a lot of worries. How did you cope with this kind of stress? What were the things that you did that helped you survive mentally during the pandemic?
Well, I think part of it was thanks to Zoom. We were able to keep in touch with family and friends really all over the world. But at least we could see that the kids were doing well and we had contact with them. As far as the country, the only thing really we could do was obey, what the CDC said, and at the beginning, not hoard masks and try to help the people that we knew who were less fortunate, but also vote for people who had our goals of public health equity in mind.
Now, I've never actually asked you this in all our pandemic conversations. What was your frame of reference for the pandemic? Was there anything in your life that you could match up against what you were going through?
Well, the one thing was the polio epidemic. So I think I was about 10. And when I was sort of aware of it, and I remember how worried my parents were, at least about me. And my brother and I were sent away to camp, which I have to say I wasn't fond of, but at least it kept me out of harm's way, I think, was one of the measures that kept me out of harm's way. But I do remember how every little symptom would be interpreted as possible polio.
Interesting. I did not realize that. So, Mom, one last question about the pandemic. Looking forward, what are you hopeful for?
Well, I'm hopeful that people who have had trouble getting all the things that make good health possible can get them. Vaccines, space, I think that's very important. Getting back to a fairly normal life, although I'm not sure what normal means anymore.
I wonder whether you'll be carrying around masks for a while, you think? I noticed that we went out once together, and every time I looked at you, you were wearing a different mask. How many masks do you carry around at once?
I think about 5, but there's some in the car. And there are a million in my closet. So I think we will, or I will, continue wearing them when I feel as if we're in a densely populated area.
Good. Now, I want to ask you a bit about the podcast. I want to ask you what your favorite episode was, and I think you said something to the effect of anything with Stephanie Desmond as the moderator. And I'm hoping that you were at least half joking with that. But seriously, I want to ask you, I know you've been one of our most loyal listeners through the whole pandemic. Could you pick out maybe 3 episodes that you particularly liked?
Well, let's see. I like the one, I think there was a mayor in Kentucky.
Nebraska, I think Nebraska.
Nebraska, right, who was just wonderful. In fact, some of the mayors, actually probably all the mayors you've interviewed, have been remarkable in how they were able to shape the opinions of their cities well enough so that people were able to keep down the COVID rates and hospitalizations. And, those mayors I hadn't heard of, but after listening, I feel like they should run for national office. They were so wonderful. The other ones were, there was one on a surgeon or an emergency room doctor who had made gun safety a priority in his emergency room, so that they asked about gun safety, how many guns were in the family home, and were able to set up a system to refer people who were at risk for violence, for committing violence, or at risk for being victims of violence. I thought that was fascinating. And then there was a big group of people who were researchers. And what was interesting was every little aspect of COVID, there was somebody who was really interested in finding out how best to treat that little aspect so patients would benefit. So, for instance, one of my doctors, a hematologist, was interested in the clotting aspects of COVID. There were others that were interested in the immunology of COVID. So that was very heartening to find that all over, people were just interested in every little aspect. I also love the book clubs. And, one of them, which discussed the plague by Camus, turned out to, the plague was the topic of conversation at our book club. So I felt like a genius after hearing the head of the Department of Comparative Literature at Hopkins discuss this. And then I went back to my own book club. So that was great. And then I love the radio hosts that you interviewed. I thought that they were terrific and provided such a big service for the community.
Great. Well, I think that they did. And I asked you for 3 and you gave me more, which pretty much sums up our entire relationship. Whatever I ask you for, you give me more. So thank you, Mom, for doing this. And I will see you on Mother's Day. And really appreciate all the support you've given to the podcast, to the family, to me, to everyone during the pandemic.
You're welcome. Thank you.
Public Health On Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Niall Owen McClusker, Matthew Martin, Spencer Greer, and Holly Cardinale, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media support from Grace Holz Fernandez. Thank you for listening.